Hi everyone, I am Supriya. We are part of Momly. We are a community that brings together women at different phases of motherhood. And we do sessions like this every week to kind of bring out different topics and bring insights on various issues. So today, one of the topics that we are going to be talking about is Diastasis Recti or DR, and we are joined by Dr. Sneha Shah. She's a women health expert and a serial entrepreneur. She's the founder of Birth Home and Fem First. She's a natural birth consultant with over 250 joys delivered. Thank you so much for joining us today, Dr. Sneha.
Thank you, Supriya. Thank you so much for having me here.
So I'll jump right into it. So the first question about DR I would like to understand is, how common is it, and can you give us a bit more insights on what is diastasis recti?
Yeah, so recently we have been talking about diastasis a lot. I mean, people are coming up with questions of what is DR, and I think there's a lot of misconceptions involved around it. So let me explain what happens. So we know that there's a six-pack muscle. These are called as rectus abdominis, right? So what happens, we have a right side of rectus abdominis and we have a left side of rectus abdominis. And in between that, there's a connective tissue which is called as linea alba. So this is how our rectus abdominis, both the sides are connected. In between, there's a linea alba. Now, at certain point of time, when there is an increase in the abdominal girth, which happens if someone is very obese, or during pregnancy when there is a sudden weight gain. When I say sudden, that doesn't mean, but yeah, in a short span of time, women do, gain a lot of weight. And along with the hormone, which is estrogen, as well as relaxin, this connective tissue, which is linea alba, it gives space for the womb, for the uterus and the baby to grow appropriately, because we want a healthy baby. So that's why it's giving the space for both the muscles to stretch and give the space for the uterus, which is expanding. So all the pregnant women do have diastasis recti, do have a separation. This is normal, is a physiological part of our pregnancy. Now, what happens in postpartum, once the woman has given birth, around 50% of the women recovers within 6 to 8 weeks of their giving birth. And around 60% women recovers in the first 6 months of their postpartum. But 1 in 3 women do need some kind of help to treat their diastasis recti. So that is when you would need an assessment from a physical therapist, because these are the ones who are expert in assessing, and then if needed, a treatment is given, an exercise protocol is given.